Hi, my name is Lauren Donathan, and I am a mom to two wonderful boys, Elijah 9 and Connor 6. My husband Daniel, and we live in Helena, Montana, right south of Helena, actually. And I am a registered dietitian, and I was diagnosed with stage 4 gastric adenocarcinoma, so stomach cancer, at 36 years old. I'm now 37. But that was back May 1st of this year, 2023. So it's still a pretty new journey for me. When I was diagnosed with stage 4 stomach cancer back in May, it was after many, many months of seeing multiple doctors who kept telling me this is acid reflux, like welcome to being in your upper 30s, or oh, the CT scan just showed constipation, go take some Miralax. And just being very frustrated knowing that I know my body and I know that's not normal for me, so that this is something that it isn't just getting older. When you take care of yourself, like it's not, you can't just blame age. So it took a long time of getting more opinions and listening and saying, no, this is not right. This is not right. Like, and advocating for myself and continuing to find those providers who would take me seriously, because there are those out there. So when the GI team here in Montana took one look at me and said, yeah, no, you look too healthy to be having all this. Like, let's really get this figured out. So after getting that stat upper endoscopy and then having that stomach cancer diagnosis on May 1st and calling down to Denver, and they were able to get me into their specialized GI cancer clinic super quickly, like the next day. And really finding a good team of stomach cancer specific providers who are well versed in this type of cancer and this treatment, and to know some of the more novel treatments that are ever growing and ever changing, especially in the gastric cancer world. Having that biomarker testing and having that PD-L1 expression, and that's where it was imperative to add on the Opdivo, the nivolumab, which is a form of immunotherapy, which I feel greatly helped the chemo work even better. And that's why from my treatment coming up with that oral chemotherapy I'll be doing, I also will continue to get an immunotherapy infusion of Keytruda every 3 weeks, because it's important that I have that, because it really is going to help that chemotherapy work. Because often that's what gastric cancer is notorious for, is not being doesn't respond well to chemotherapy most of the time. But they have found a lot of times that is because of some of those biomarker expressions, and that has been why. So the immunotherapy is helping that. So that was where I started with my 4 rounds of FLOT, and then with my PD-L1 biomarker being positive, added on the Opdivo immunotherapy. And then halfway through, the regimen is supposed to be either 4 rounds of FLOT and the immunotherapy, surgery, and then finishing with 4, or all 8 up front. But I needed my stomach cancer, the cancer in my stomach was so bad, we needed to do that at that halfway point. So that sandwich effect. So I did the 4 rounds of FLOT plus the Opdivo, and then had the big partial gastrectomy and the cytoreductive surgery, HIPEC, ovaries removed, a J2 placed for some feeding. It didn't last very long, and then I finished off with supposed to do the 4 rounds of FLOT, only ended up doing 2 because I was having a hard time tolerating that. But so I had what they call a partial or a subtotal gastrectomy, where they removed different portions depending on the person and where their cancer is. So my cancer was located distally, so the lower part of my stomach, right at my duodenum, and where the tumor was actually blocking the passage of food from my stomach to my small intestine, and it was almost completely blocked by the time I went in for surgery. So they removed the bottom 3/4 of my stomach. So I have about, he said, a walnut size portion of my upper stomach left. That is where my journey has been, and I will be starting oral chemo with more immunotherapy here shortly. I hope that by telling my story, other patients can know the right questions to ask and to advocate for themselves, really keep, asking questions. And if you don't feel like something's right and you have a bad feeling about something, like, you're probably right. Like, your body, and to just continue to ask those questions, not be afraid to get other opinions, not be afraid to ask for certain tests. I even asked, I was like, hey, was I tested for the Claudin 18.2? Or, let's ask make sure that you're tested for those biomarkers. If you feel really worn down, ask for another blood marker. Like, don't be afraid to ask for certain tests and ask about different treatments. Like, hey, I've heard about these 3 chemo drug combinations, and like, is that something that you do at your facility? And so do your research, get to know other stomach cancer patients and the treatments that they've had and the therapies they've had, and kind of maybe even keep like a notebook of all the different ones, but it can be pretty overwhelming, and ask about all of those and make sure that your care is tailored to your numbers and your genetics and your specific cancer.